UT Physicians is here to help build a home for a hardworking family that's just trying to get a hand up in this world.
I have been working, putting hurricane strips in and hammering and nailing. A lot of work goes into building a house. You know, sometimes we think it just magically appears, but I'm learning about framing and how we can secure a house. So it's been really exciting to do this.
It's really great to be able to step away from what I normally do and we do as surgeons and physicians in our practices and come do another personal interaction out in the community.
Well, we know that you volunteer just as a regular day as part of your sweat equity to work on this build site. Yes. But what you don't know is that this is your home that you're building today.
I'm a single mom with 2 kids. I've been trying to get a house for the past years and it's hard. It's hard to pay rent alone in a 1-bedroom apartment, but I didn't give up. I worked hard for it, and last year I applied and I qualified, and now I'm working towards my goal of having a home for my daughters, which is what inspired me to, what pushed me to do it.
The biggest pleasure of this is the gift of a shelter for a family, even at this time when the economy has been impacted by COVID-19. The fact that we can still bless families with this is something that gives me so much pleasure and happiness to be part of this.
Affordable housing has always been an issue in Houston, even before Harvey, even before the virus, but even now it's even more important.
One of the things that's really important to UT Physicians is to make sure we get clinics in the underserved areas. And as a matter of fact, we have a clinic that's really not far from this location where we are. And I think it's so wonderful to have accessible health care for our community, for our patients, so that we kind of eliminate that barrier for them.
I have 2 daughters. Knowing them, I know they're going to be more than happy, thrilled. For Alma especially, my 17-year-old, she's been wanting her room since she was probably 9 years old.
Being a part of UT Physicians during this time has been invaluable to me. I feel really proud to be a part of a team that is still prioritizing community service.
We have some virus precautions that we've initiated. Some of those include reducing our volunteers on the build site. We've also instituted more sanitation policies.
Doing healthcare in the middle of a pandemic has certainly been a challenge. Been a lot of just extra work trying to figure out how to interact with our patients in a safe way.
This experience has been amazing. I really like the fact that we're giving back to the community even during the time of COVID. We're practicing social distancing while we're on site. I definitely feel that even during COVID, you can get out there and contribute to the community, give back in any which way that you can.
Habitat, the guidance that they give you towards achieving that goal is just amazing. You don't feel lost along the way, and that's the most important thing, because they guide you through every step of the way, and that's what has helped me understand, the whole process about being a homeowner.
As a kid growing up with 2 older sisters, always having to share the room with the parents, it really means a lot. So I know what it means when I see these kids, picking out their own room.
As one that has a home myself, and I had aspiration to have one, and then the pleasure of having one, and they get to benefit that means a lot and gives a lot of resonance to what life is about, which is to never give up and to keep pushing despite whatever challenge comes our way.
I'm a product of an underserved community, and I'm really proud that a family is going to be receiving this home, and that makes me really excited.